Namaste Vidya, Hamesha Khush Raho Vidya. A very good morning to you all. Myself, JVN Dr. Ravi Jain, Associate Professor and HOD, Department of Practice of Medicine and Faculty of Homeopathy Science at JYOTI Vidyapeeth Women's University, Jaipur. In this series of lectures, we have been discussing about various endocrine diseases. Today, we are going to start with diabetes mellitus. Diabetes mellitus is a very important disease that is affecting a lot of individuals in day-to-day population. Diabetes mellitus is not only important as a disease itself, but also important because it has lots and lots of complications. We will also be discussing about the complication of diabetes in this series of lectures. Diabetes is considered to be a lifestyle disorder that is arising because numerous factors. So let us start with diabetes mellitus and try to see what are the various factors that are responsible for diabetes mellitus and what are the clinical features, how to investigate a case of diabetes mellitus and how to manage them. Diabetes mellitus comprises of a group of metabolic disorders. So this is not a single disorder, but consists of a group of metabolic disorders that share common features. Common features of hyperglycemia that is resulting from. So in case of diabetes mellitus, there is increased level of blood sugar that is known as hyperglycemia. And this can result from number of mechanisms like defect in the insulin secretion, defect in insulin action, or both. So either there is deficiency in insulin secretion or there is defect in the insulin action, or both can be the cause. It is classified on the basis of pathogenic process that leads to hypoglycemia. So any pathogenic process that leads to the development of hypoglycemia will be responsible for the classification of diabetes mellitus. So what is diabetes mellitus? It is a disease condition. It is a metabolic disease condition that shares the common features of hypoglycemia that are producing hypoglycemia. And this hypoglycemia is resulting from either defect in the insulin production, means secretion, and action, or both. So either there is defect in the insulin secretion or there is defect in the insulin action, or both. Now this is pancreas. Pancreas has, as we know, has both exocrine and endocrine function. In the endocrine function, in the pancreas, there are beta cells that are producing insulin. And when there is defect in the secretion of the insulin, or if the proper insulin is secreted but the action is deficient, this leads to development of diabetes mellitus. Now, based on the pathogenic process, the diabetes mellitus is classified into two parts. One, we have type 1 diabetes mellitus, and second, we have type 2 diabetes mellitus. Type 1 diabetes mellitus is characterized by insulin deficiency and a tendency to develop diabetic ketoacidosis. So in case of type 1 diabetes mellitus, there is absolute deficiency of insulin hormone, and the patient is more prone for development of diabetic ketoacidosis. In type 2 diabetes mellitus, there are heterogeneous groups of disorders. So there are different types of disorders that are characterized by variable degree of insulin resistance. So there is insulin resistance, impaired insulin secretion, and excessive hepatic glucose production. So in type 2, there are different types of disorders and that are characterized by variable degree of insulin resistance. So there is a variable degree of insulin resistance, mild to severe. Impaired insulin secretion, this secretion becomes impaired, and excessive hepatic glucose production. So there are three things that are happening in case of type 2. Insulin becomes resistant, and when the insulin becomes resistant, the body starts producing more and more insulin, and ultimately what happens that the cells burn out and ultimately leads to impaired insulin secretion, and ultimately there is excessive production of glucose by the liver. Now, there are also other specific type of diabetes mellitus, which includes genetic defects. Genetic defects which consist of maturity onset diabetes of the young, that is known as MODY, maturity onset diabetes of the young individuals. Disease of the exocrine pancreas, which includes chronic pancreatitis, cystic fibrosis, and hemochromatosis that leads to development of diabetes mellitus. Endocrinopathies. There are various endocrine disorders that can lead to development of diabetes mellitus, which includes acromegaly. We have Cushing syndrome, glucagonoma, pheochromocytoma, and hyperthyroidism. So in endocrinopathies, we have acromegaly, Cushing syndrome, glucagonoma, pheochromocytoma, and hyperthyroidism. There are various drugs. The drugs includes nicotinic acid, glucocorticoids, thiazides, and protease inhibitors. Pregnancy is also responsible for development of gestational diabetes mellitus. So other specific type, we have genetic defect, which includes MODY, that is maturity onset diabetes of the young individual, diseases of the exocrine pancreas, like chronic pancreatitis, cystic fibrosis, and hemochromatosis. We have endocrinopathies, which includes acromegaly, Cushing syndrome, glucagonoma, pheochromocytoma, and hyperthyroidism, and various drugs like nicotinic acid, glucocorticoids, thiazides, proteases inhibitors. Pregnancy, which includes gestational diabetes mellitus. Now, the phenotype of these monogenic and secondary types of diabetes mellitus typically resembles type 2. The types that we have just discussed, the phenotype means the clinical features, the external appearance of these monogenic and secondary type of diabetes mellitus resembles type 2 diabetes mellitus, and the severity of this disease depends upon the degree of beta cell dysfunction and prevailing insulin resistance. So the severity of the disease depends on the degree of beta cell dysfunction and prevailing insulin resistance. Now, let us discuss about type 1 diabetes mellitus. Type 1 diabetes mellitus is also known as juvenile onset diabetes mellitus. Since there is absence of insulin secretion from the beta cells of pancreas, so this disease is affecting the individual in a very young age, because the peak incidence is children and adolescent. And this is resulting, type 1 diabetes mellitus is resulting from the autoimmune destruction of the pancreatic beta cells. So the beta cells of the pancreas are getting destroyed, which produces a deficiency of the insulin hormone and ultimately leads to the development of type 1 diabetes mellitus. Now, why we are concerned about diabetes mellitus so much? We are concerned about diabetes mellitus because diabetes mellitus prevalence is greater than 8% of the population, increasing with age. So, 8% of the cases are suffering from diabetes mellitus, and this prevalence is increasing with age. There is a significant portion of the persons with diabetes mellitus who are undiagnosed. So, a lot of people with diabetes mellitus remains undiagnosed, and it is attended by serious morbidity and significant mortality. So, there are a lot of clinical features of diabetes mellitus for the patient who is suffering from it. And there are also various complications, as I have just told you, that diabetes mellitus is responsible for lots and lots of complications. And we will be discussing about all the complications one by one. And this is the fifth leading cause of death worldwide. So because of diabetes, every year, lots and lots of people are losing their lives. Now, what are the risk factors? Who are the individuals who are prone or who are at risk for development of diabetes mellitus? So individuals greater than 45 years of age. As the age progresses, the chances of diabetes mellitus increases. Overweight individual with a BMI greater than 25 kilogram per meter square. Family history of diabetes, those individuals who are having a family history of diabetes mellitus. And habitual physical inactivity, those people who are not doing any kind of physical activity. And previously identified IFG, that is insulin-like growth factor 1, or impaired glucose tolerance test. So at-risk individuals are those individuals who are of greater age, more than 45 years of age, overweight with BMI of 25 kg per meter square, family history of diabetes with habitual physical inactivity, and previously identified IFG, that is insulin-like growth factor or impaired glucose tolerance. Other risk factors includes history of gestational diabetes mellitus and delivery of baby more than 9 pounds, that is more than 4.5 kilogram, hypertension with blood pressure more than 140/90 mm of Hg, polycystic ovary syndrome, and history of valvular disease. Now let us come to the clinical features of diabetes mellitus. Whenever a patient of diabetes mellitus is coming to us, what are the clinical features that we are going to see with it, in that particular patient? So the onset of diabetes mellitus is usually gradual. So gradual in adults, but in children, the disease comes suddenly. The symptoms includes thirst, that is dry mouth. Just try to remember this particular disease condition with 3 poly. polydipsia, polyphagia, and polyuria. So polyphagia means increased appetite, polydipsia means increased thirst, and polyuria, that is increased frequency of urine. So there is increased appetite, increased urine, and increased thirst in a person who is suffering from diabetes mellitus. So we have thirst with dry mouth, polyuria, nocturia, hyperphagia, that is increased appetite for food, tiredness, fatigue, and lethargy. The patient remains tired and fatigued, and there is noticeable change in weight. That is usually weight loss is seen in those individuals. There is also blurring of the vision. The person vision becomes blurred. Pruritus bulbae in female and balanitis in males is seen. There is loss of libido, that is decreased sexual drive, and erectile dysfunction is seen in males. Nausea and headache is also present. Since the person is having diabetes and there is a restriction of sugar and sugar substances in patients, so he becomes more and more predilected or prone for towards sweets. The mood changes takes place, and the patient becomes irritable and difficulty in concentration and apathy. Apathy means there is no desire to do any kind of work. So the person is more predilected for sweets. There are mood changes. There is irritability and difficulty in concentration with apathy. Now, how to diagnose a case of diabetes mellitus? Whenever a patient of diabetes mellitus is coming to us, how can we diagnose? First of all, the symptoms that we have just discussed must be present. Plus, test the urine for glucose and ketone bodies. Measure the random or fasting blood glucose. Diagnosis is confirmed by either the fasting plasma glucose is more than 126 mg per dl or random is more than 200 mg per dl. Then we can also go for oral glucose tolerance test. And in the oral glucose tolerance test, again, we have to see for the blood sugar level. If it is in fasting, it is more than 110 to 126 mg per dl, or if in random, it is more than 140 to 198 mg per dl. The mechanism I'll be discussing in the classroom itself. And just you have to remember one thing, that in case of glucose tolerance test, the plasma glucose is measured before 2 hours and after before and after 2 hours of 75 gram glucose drink given to the patient. The interpretation of the plasma glucose, fasting hypoglycemia, and there will be sugar level from 120 to 125 mg per dl, and 2 hours after glucose load, it should be less than 140 mg per dl. In case of impaired glucose tolerance test, the fasting is less than 126, and after 2 hours, it is 140 to or 199 mg per dl. In case of diabetes mellitus, it is more than the fasting glucose level is more than 126 mg per dl, and 2 hours glucose load is more than 200 mg per dl. Now, how to manage a case of diabetes mellitus? Whenever a patient of diabetes mellitus is coming to us, since we know there are lots and lots of complications, how to manage it? So, as I have just discussed with you, that it is considered as a lifestyle disorder. So, the first and foremost thing that we are going to advise the patient is to dietary and lifestyle modification. The patient has to do lots and lots of dietary changes and lifestyle, like go for walking and all. Administration of oral anti-diabetic drugs can be done, and there are also injected therapies where insulin injection is given to the patient. The oral hypoglycemic agent includes those drugs that can increase the secretion of insulin, like sulfonylureas, insulin sensitizers that can sensitize the beta cells of pancreas for production of for the synthesis of insulin, and drug modulating digestion. This is usually given for constipation. So, optimal treatment of diabetes mellitus requires more plasma glucose management. Education about nutrition, exercise, care of diabetes during illness, and medications to lower the plasma glucose. And patients with type 1 diabetes requires 0.5 to 1 unit per kg per day of insulin in divided doses. Metformin is usually given. Patients with type 2 diabetes mellitus are managed with diet and exercise alone or in conjugation with oral glucose lowering agents, insulin or combination of oral agents and insulin. In the oral agents, we have metformin that has the advantage that promotes mild weight loss, insulin it lowers insulin levels, improves the lipid profile, and lowers cancer risk, and does not produce hypoglycemia. As endogenous insulin production falls, multiple injections for long-lasting and short-acting insulin may be required, and bariatric surgery is considered for obese patients. So in case of obese patient, we can go for bariatric surgery. So this was all about diabetes mellitus. I hope you must have understood the session properly. In the next lecture, we will be discussing about diabetic ketoacidosis. We will also be discussing about the therapies of the diabetes mellitus, the various homeopathic medicines that can be used in case of diabetes mellitus in the upcoming lectures. So this was all for today. Thank you very much. We will be meeting in the next lecture with diabetic ketoacidosis. That is one of the important complications. So thank you very much. Have a good day.